Good morning, guys. I hope we're all sparkly. Today I thought we'd go through a case study. Now this guy has been under my care and supervision for 2 years, and he attended for his annual review last week. So he originally presented with a secondary stroke functional hypergonadal picture, which essentially means he wasn't sending enough LH and FSH down to the testicles to produce enough testosterone for growth and repair, for mood, for all the things that we talk about. And he had lots of negative symptoms associated with low testosterone. And despite his best efforts, he was gaining weight, not losing weight, with a healthy diet, training. So he was struggling. So he was placed on 12.5 milligrams of TRT daily via subcutaneous injection, 100 IU of HCG daily via subcutaneous injection, 5 milligrams of tadalafil. We're fans of tadalafil for obvious reasons. And he was also placed on 0.25 milligrams of anastrozole every 3.5 days. Now, it's not my standard protocol, but this guy was struggling to lose weight, and he was a bit of a chunky monkey despite his best efforts. So we did give him an AI straight away. It is incredibly unusual to do that, but we thought it was in his best interests, so we rolled with it, because it's not about just facing the numbers, it's about acting in the best interest of the patient, and it must be considered. So there isn't a one-size-fits-all methodology and protocol, but yes, microdosing TRT is the starting point. Daily injections of TRT and HCG to mimic physiology. Wake up, guys. This is the best protocol to start with. So yeah, he's been under my care and supervision for 2 years, and he's doing really well. He's in a far better state. So he had his blood test done in clinic. Now, we often get blood tests done prior to the annual review because obviously we can assess the blood test along with the qualitative symptoms, but sometimes the patient has the blood test done in clinic. Now again, when you're assessing a patient, you want to assess them, not just the numbers. And the numbers can bias your opinion. So he had his blood test done, and his blood tests come back a few days later. And we were going to decide what to do based on what we discussed and his numbers. So you assess everything. So during the discussion, he was doing really well on pretty much all aspects of his health, but he was struggling with daytime fatigue. Now, fatigue, how many causes are there for fatigue? Now, a bad night's sleep is an obvious cause. And this guy had been diagnosed with obstructive sleep apnea, and he'd been commenced on CPAP, but he was struggling with compliance. The machine wasn't reading properly because he had a poor fit around his mouth. This guy's got a beard. So I said, shave the beard off. Disappointingly, as cool as you look, it's not going to help the seal. And I prefer to have a full night's sleep than a cool beard. So, yeah, he shaved his beard off. And he reported back to me a few days later that actually, yes, he's now got a score of 100, a perfect score. So hopefully his daytime fatigue somnolence will improve, and he will be the person that he needs to be. He's putting the work into all other aspects of his health. He's looking at his nutrition. He trains. He's got an incredibly stressful job. He's actually, how can I say, he's a civil servant, and he's exposed to lots of serious stuff. So yeah, he needs to be on point. So again, you must adopt a holistic approach to health, and it's not all just testosterone. So if we hadn't known all these things and we just looked objectively at the numbers, what would we say? Well, I have his blood report here. Now, we'll get to the nitty-gritty straight away. Testosterone, 18.3. Now, you're going to say that's pretty suboptimal. And you would be right if he had a high normal or normal SHBG. But he doesn't. He has a low SHBG. So his SHBG is 12.8. Now, as you guys know, SHBG is my favorite glycoprotein. It acts as a buffer. It's incredibly important to try and raise this so that you feel subjectively as good as the numbers look on paper. If you've got low SHBG, you can sometimes have objectively good numbers and still feel rubbish because you don't have that buffer effect. The SHBG grabs hold of DHT, then testosterone, then estradiol. And it's all about what? It's all about ratios and restoring that equilibrium. So always try and raise your SHBG because it is a positive metabolic marker and it's going to make you feel better. Lots of patients think, oh, I need to lower my SHBG because some dickhead on the internet said, yeah, you don't need to worry about SHBG. Well, you do. So look to be the best version of yourself by improving your metabolic health, and that will translate into an improved subjective appreciation of how you feel. Because your physiology is incredibly important. You can't outthink your physiology. So look to improve your physiology by doing the things that you should be doing. So yeah, actually 18.3 total testosterone with a SHBG of 12.8 yields a free testosterone of 0.578, which is actually great. So as you guys know, most of my patients like to be between 0.5 and 0.85. That's where they subjectively feel best. They don't tend to have complications as a result of that free testosterone. And again, as I've just said, low SHBG guys don't have the buffer effect. So they actually feel better with slightly lower SHBG, lower free testosterone levels. And again, as alpha males, we always want to be high normal, but low SHBG guys don't feel good with high normal free testosterones. They actually feel better with about 0.5 to 0.65. So this guy is actually bang on with his free testosterone. So what's happening with the rest of the panel? Well, his estradiol is 182. So most guys subjectively feel best between about 80 and 130. So he's got quite high estradiol, and he's already on an aromatase inhibitor, 0.25 milligrams of anastrozole every 3.5 days. It's not my usual choice. Normally it's examestane, but for some reason, I can't remember why, back in the day, I gave him some anastrozole. But he's doing really well, so why change? If it ain't broken, don't change it. Now, the current testing methodology that we have isn't particularly specific. So what lends suspicion to that this is actually pathological? Well, actually, he's also got a raised prolactin. So estradiol inhibits prolactin inhibitory hormone, aka dopamine raising prolactin. It also has a direct effect on the pituitary, raising prolactin. So if you see a raised prolactin alongside a raised estradiol, that gives you more suspicion that this is something that you might want to be addressing. So yeah, healthy testosterone, high estradiol. So what should we do? Well, his now current protocol is 13.75 milligrams of test-CYP, 100 IU of HCG, 5 milligrams of tazanafil, and 0.25 of anastrozole every 3.5 days. So there are a few options here. So what should we do? Now, if we played around with the testosterone and the HCG dose, we could help alter the testosterone to estradiol ratio. So perhaps we should go with 15 milligrams of test-CYP, 80 IU of HCG to alter that testosterone to estradiol ratio. That's not a wrong choice. It is potentially the right choice. What else could we do? Well, we've noted that he's got raised estradiol and prolactin, and we think it's pathological because the prolactin's gone up with the estradiol. So we could raise the dose of the aromatase inhibitor. So we could go with 0.5 every 3.5 days. Now, would that be the wrong thing to do? I don't think it's necessarily the right thing to do, and actually it's probably the bottom of my list of things that I would want to do, because less is more. Now, if we raise the dose of the AI, and it has more of a fixed dose response, despite it not being the suicidal aromatase inhibitor that, like examestane, it actually competitively competes at the aromatase enzyme. I don't think that's the right thing to do. So, what else could we do? Well, we could do nothing. Now, why would we do nothing? Because we've already said he's got a healthy testosterone, but a raised estradiol and prolactin. Well, we could do nothing because he doesn't feel terrible. In actual fact, he feels really good. And the only thing that he's got is daytime fatigue. And what's happened? Well, he's been on CPAP, but the fit's been poor, and you must have a good night's sleep to feel good. He's now shaved his beard off, and he's got 100% score on his sleep. So if he gets good sleep Will he be tired in the daytime? Unlikely. Now, what else happens? Well, it's not just one thing, is it? So if he gets a good night's sleep and it has a restorative effect, he's likely to be more energized in the morning, and he's likely to be more productive, and he's more likely to make the right choices when it comes to diet. Now, what do we do when we're tired? We tend to crave carbohydrates. So if you crave carbohydrates and you place a lot of stress on your liver, what are you doing? Well, you're potentially increasing the rate of aromatization. If you are eating too much, and when you're tired you tend to eat too much, you're going to create a little bit more adiposity. So what's in adiposity? Yeah, the aromatase enzyme raising estradiol. So actually, this guy, I've said, will do nothing to your protocol. Let's concentrate on improving your metabolic health for a number of reasons. Number one, improving metabolic health is going to raise SHBG, which is going to impact the testosterone to estradiol ratio, which will hopefully translate in an improved sense of well-being. And also, it's going to mean that you're not going to be making the wrong choice, you're going to be making the right choices. And if you're not going to place stress on the liver and you're going to lose further body fat, your rate of aromatization, your estradiol, is going to come down. So we don't necessarily want to be doing anything with this guy. But objectively, if we looked at the numbers, you go, well, let's do something. And that's the importance of having a doctor-patient relationship where you actually see the patient, you actually have a proper conversation, because it's not all testosterone. What else is going on with this guy? And as we are highlighted today, it was the sleep that was his major issue, and the sleep, correcting that, will impact everything else. So you must always have a holistic approach to health, because everything affects everything. As we said before, all hormones are dependent, whether that relationship be direct or indirect. And we've said that everything affects everything. So you must always have a considered approach to medicine. There's no place for dogma. None. So work with the patient so it's in his best interests, so that he can get healthy male androgen levels to do what? Yeah, you guessed it. Go earn his reward.